We have an incredible storied history here at VCU School of Pharmacy, 125 years of not just pharmaceutical and pharmacy related education, but thinking critically about how to push the envelope. Donor support is absolutely critical for us to make the next leap. Over the next 125 years, what do we want to be known for? I'd offer debt-free education. Students are thinking about what they go into, how they want to serve, but finances often come first. And so if we can remove that barrier, we're going to get the best and brightest students, but also those students are committed to truly improving the human condition. This idea of pharmaceutical manufacturing.
For pharmacists, our supply chains are very fragile. We don't have a whole lot of production capability here in the United States. We have to diversify those supply chains and have some production closer to home of those most essential generic drugs.
The Commonwealth is going to be a beacon for what's happening across the country as it relates to reshoring efforts. When you look in Chesterfield, some of the scale-up facilities that are being built in that area, and the massive investment in Petersburg, Flow and Civica and AMPAC. Thinking specifically about VCU and the School of Pharmacy, our pharmaceutical engineering program is the first of its kind in the country, offering a PhD with the idea of building workforce in a meaningful way. So the 95 corridor is going to lead to strong pharmaceutical manufacturing and helping link the academic side with the industry partnership side to make sure that there's no longer that valley of death where great ideas go to hopefully serve the patients that need it most.
We also need to be looking at the quality and safety of our generic drugs. We had offshored so much of our production to countries where the FDA did not have a full-flung regulatory system. So we don't have a level playing field, and we don't have level quality assurance. There's an opportunity here to test products.
Thinking about the quality and safety, we have a bioanalytical lab here at the School of Pharmacy that gives us the ability to do surveillance testing for a number of health systems in the region.
We have great opportunity at the School of Pharmacy for research, for surveillance testing. And I think there's an opportunity to improve clinical care.
I strongly believe that pharmacy needs to move away from only being reimbursed for product to be reimbursed for services. The school can play a role in helping shape what those clinical services look like and support their curriculum.
We could be known across the country as a School of Pharmacy that's truly driving change. Policy, advocacy, legislative actions. We're making sure that pharmacists are forefront of our community health efforts, our population health efforts, that allows pharmacists to carry out those services in a meaningful way.
So as I think about how pharmacy is changing and the role that the school plays, I believe in giving back to what the school enabled me to achieve over my career so they can help other students as they embark on their career in pharmacy.
How do we create a workforce that is truly ready to change what healthcare looks like, not just today, but tomorrow? We need donors rallying behind our faculty, our staff, and students, and making a commitment to say, we also believe in the School of Pharmacy, and there's great years ahead.